450,000 New Yorkers are about to lose free health insurance. We're talking about real people in Westchester with real jobs. On July 1st, they're gone. This is the Westchester Brief. I'm Jim. Let's get into it. In March, the Trump administration eliminated federal funding for New York's Essential Plan. That's the coverage that provided free or near-free health insurance to working people who earn just enough to disqualify them from Medicaid, but not enough to afford market rates. Starting July 1st, 450,000 New Yorkers lose it. That includes tens of thousands of Westchester residents. These aren't unemployed people. These are people with jobs. An individual earning $32,000 to $40,000. A family of three making $54,000 to $68,000. They're teachers' aides, home health aides, small business owners, service workers. People earning 200 to 250% of the federal poverty line. When that coverage ends, they'll be shifted to qualified health plans. That means monthly premiums they can't afford, deductibles, out-of-pocket costs that spike into the thousands. For some, it means no insurance at all. For others, it means choosing between health care and rent. The impact on Westchester's safety net is real. Our county's hospitals and clinics that serve low-income patients, Westchester Medical Center, the community health centers in Yonkers, Mount Vernon, New Rochelle, Peekskill. They're already stretched thin. Losing 450,000 covered patients means lost revenue, budget cuts, staff layoffs, reduced access, possible closures. The math is straightforward. The State Department of Health got approval to preserve coverage for 1.3 million other enrollees. That cost money. The governor's executive budget set aside $2 billion as a contingency. That's significant, but 450,000 people is a lot of people to leave uncovered. State legislators have introduced bills to cover the gap, to extend the Essential Plan, to protect Westchester residents from losing coverage. But there's no vote yet, no timeline, no certainty. Here's why this matters now. These people are about to receive notices in the mail. Some already have. The notices tell them their coverage ends July 1st. It tells them about special enrollment periods, about plans they can move to, but it doesn't tell them the full truth. The coverage they're moving to costs real money. A lot of it. Some of these people will choose not to enroll. They'll go uninsured. They'll delay medical care. They'll show up at emergency rooms when things get bad. Governor Hochul's administration is aware. Senator Shelley Mayer is pushing the legislature. Westchester County's health department is preparing for the impact. But preparation isn't a solution. The real question is what happens on July 2nd when 450,000 people wake up uninsured? The answer depends on whether the state legislature acts, and fast. Here is what else is happening across Westchester this week. The county is facing a $197.7 million budget gap. The legislature cut 180 positions. For the first time in 7 years, tax increases are coming, 3.7%. Your county tax bill is going up. The SALT cap is at $40,400. U.S. Representative Anthony LaLota is pushing Congress to extend relief before the cap reverts to $10,000 in 2030. If Congress doesn't act, your state and local tax deductions could get cut in half. New employment law takes effect April 18th. Employers can no longer use consumer credit history as a factor in hiring decisions. If you apply for a job and get rejected, they can't point to an old debt. That's a win for working people trying to get ahead. I'm Jim, and I live here. I'll see you tomorrow.